Other key pieces of advice: no increase in swelling. And if your knee is swollen, I do have patients who are ultra runners and they have a bit of swelling, but they manage it well and they're totally fine with it. And I mean, that's fine. My role is to guide them and make sure that they don't get a lot of swelling. But if they have a little bit, but it's always there, then why not? Otherwise, if your knee is really flared up, then just get on the bike, try to get that swelling out, and then reload gradually after. No increase in symptoms during running, ideally. And if it does increase a little bit, then it should be back to pre-running symptoms within an hour after you're done. And the next day when you get up in the morning, no increased stiffness the first few steps. Right? So basically you want to adjust their training program based on these markers. And I can't feel it. So what I tell people is, like, here's a suggested progression or suggested program, but you are the best judge. So depending on how you feel, you can adjust this way and that way and that way, and just make people responsible for their own progression. No limping. It sounds obvious, but I've seen people running and favoring one leg. So it's not ideal. And then when you feel better, I would increase volume first. That's typically what I do. So increase volume on flat. It can also be run walk. It doesn't have to be continuous running, as long as you increase your mileage first. It could be up to, say, an hour of running, and then you remove maybe some volume to add a bit of speed. So you created a bit of a buffer of adaptation to replace that with speed work, and eventually the hills. It really depends on how the person feels, and there's so many different possibilities, and it depends on their objectives and whatnot. But that's the typical progression that I like to follow.